Okay, so today we're going to have a fun class. It's not so serious. It's not going to be a lecture and all of that. The first thing that we're going to do is we're going to go through our medical terminology again, and I've added another word. So if you need to grab a pen and paper real quick to make notes of that, and if not, remember I'm recording this and it'll go under daily assignment and you can go back and review it. We're going to do that first. And you're going to find that during class, Zoom class, that will be the first thing that we do every day or every time we Zoom is we're going to go through those medical terms, because by the time you're done with the course, I want you to know some medical terms. And we may switch and go to a new list, you know what I mean? But right now we're trying to just getting started. We're starting to build our toolbox for things that's going to help us understand when we're reading our medical records. The second thing we're going to do today is we're going to watch 2 different Dr. Pimple Poppers. And if you have a queasy stomach, I understand you don't have to look, but I want her to be able to show you the difference between incision and drainage and removal just visually, because when we're looking through that part of the integumentary system of our CPT, you're seeing incision and drainage, removal. We need to know the difference between benign and malignant, and we need to be pulling our CPT codes from those particular portions. You can't use a malignant CPT code for a person who has a benign tumor, because what have you put into their medical record then? That they have a history of cancer. You don't want that, because just like if you accidentally coded HIV and that went into somebody's medical record, there's a national registry for HIV. It's really hard to, especially HIV and stuff like that. Those are really hard to get your name taken out. With cancer, it's a little bit easier to pull that back, but we have to be careful, because when you're talking about illnesses that are that serious, we have to make sure that we're amending the correct CPT code. So just make sure that you're looking for whether it's benign or malignant. That should pop out at you the first thing, right?
Yep.
Okay. So I'm just kind of looking through, we were talking about debridement and paring and cutting, punch biopsies. Dr. Pimple Popper does punch biopsies, but I didn't pull one of those this time. But I'm telling you, if you enjoy Dr. Pimple Popper, once you're kind of looking through your integumentary system, CPT, and kind of looking at that, go ahead and watch some of her stuff and listen for those terms that she's using and match them up with your CPT codes. That's a fun way to practice coding. It gives you the real world part of it. It's not written down, it's actually verbal, but to me, it's very interesting. So let's go ahead and move into our medical terminology first. So here we go. Okay, so our first suffix is itis. Who remembers what itis means?
Inflammation.
Inflammation. Dermatitis, inflammation of the skin. Gastritis, inflammation of the tummy. So it means inflammation. Gastro, gastro.
Stomach.
Stomach, yep.
Stomach.
Wrathy.
Suture.
Suture. I have the hardest time remembering that one. Ectomy.
Removal.
Removal.
Surgical removal. Nephro or nepher.
Kidneys.
Kidney.
Kidney, yep. Plasty.
Surgical repair.
Surgical repair. Or I put surgical report. I'll take care of I'll fix that. Whoopsie. Scope.
Visual exam.
Visual exam. Ah, this is our new one. Algia means pain. Algia. Have you heard of fibromyalgia?
Yes.
Yep.
Okay, so that's our little list. Are we ready to move on to Dr. Pimple Popper?
Sure.
All right, here we go. So we're going to be looking at a man with the standing world record of the largest cyst ever. And this is really gross.
What do you got here?
It's a big monster.
It's a little friend growing on you, huh?
Yeah.
So how long have you had this?
I've had it since I was around 12 or 13 years old. It was manageable, but in the past year or year and a half, it's just ballooned.
Yeah.
I slam it
Okay.
into doors, I slam it into chairs, I
Yeah.
slam it into all kinds of stuff.
I have never seen anybody with a ball like this
Really?
and this size on this area on the body.
It's really unusual to see something of that size in that area. So it gets me to wonder, is this a lipoma? Is this a cyst? Is this something else? Good mystery. And Ronan certainly has a mystery here.
What's in here? Is it a liquid or a solid? So initially I'm just going to numb up one area and just see if we can't pull out any fluid. And if it doesn't happen, then we know it's something more solid, and then we can go ahead and make a longer excision. I hope that doesn't scare you. Any of this scares you, does it? We're gonna get rid of this. Don't you worry about it. I'm just gonna see if I can pull any fluid out of here, all right?
No problem.
Come on, something's coming out, but not a lot. See that right there?
Yeah.
I think that might be a cyst. It looks like cyst fragments. If it were gel, like from the knee, it would look like hair gel. You know what? I think you got the world's biggest cyst, and we're gonna remove it right now.
Oh my God.
So,
Is it too late to back out of this?
better not back out, we're here.
This is the biggest cyst that I've ever seen. This is the standing world record of Dr. Pimple Popper's biggest cyst ever.
Okay, this might get wet.
I mean, if you blow a balloon up enough, it's gonna pop. And so I'm just shocked that he has a cyst here that is blown up to this size and the balloon hasn't popped.
All right, we're gonna have to squeeze it. All right, you ready? Get this cyst out of your system here.
Oh God. Oh my God.
That is a lot of cyst.
Oh my God.
That's
Ew, right?
Look like cottage cheese.
I
Yeah,
had to
that's
look
what I
away.
Look like cottage cheese.
I was like, nuh-uh.
She called it oatmeal. Okay, so hi, Erin. Hi, Alexis. Glad to see you guys. So let's talk about a couple of things. I hope you paid close attention because one of the first things that she did what? Anesthesia, right?
Mhm.
So what kind of anesthesia would she have used?
Is it local?
Local anesthesia.
She would have used local anesthesia because we just wanted to numb that one area, right? We didn't
Yeah.
need to numb his whole leg, correct? Okay, what about the instruments? Let's talk about that. So she did the anesthesia and she did the instruments. Was that going to be part of her surgical package? It will be part of her surgical package. She's going to take all of that and come up with one price for it. Now, hi, Erin. Now, if she would have had an anesthesiologist come in and do the anesthesia, then we could have let him build the anesthesia, right?
Right.
But she did it right there in the office. This is an office outpatient kind of situation. Okay, now, so we know that she's going to charge one price for everything that she's doing, right? Okay, so she said something. She said she was going to remove the cyst. Did she actually remove the cyst? Or did she incised and drained?
She incised
Inside the
and drained.
drain.
Right. So even though she said, which in essence removes it, but I'm going to show you the kind of removal in just a second that is actually a removal. This was incision and drainage, which was pretty disgusting, right? Does anybody have a weak stomach? I love all this gross stuff. I can't help it. I love it. Okay, so let's go to our next one. Okay, here we go.
Results that I can leave here with no bumps on my head.
Okay, here's Big Mama. Make sure nothing's ever hurting you, okay?
Okay.
I really have to approach this systematically and just make sure that each one is in good condition before I proceed to the next.
It's like you're deciding whether you want to pop this balloon or not. One little cut too deep and it's gonna spill out.
It's always risky removing a cyst of this size, especially on the scalp. The scalp is extremely vascular, and so if you get a little blood vessel that bleeds, sometimes it's hard to see where it's bleeding and hard to stop the bleeding. So that always complicates things and can slow you down.
Just treating it with some mad respect, let me tell you. This thing is like your old friend. Guess what? He's gone.
Really? Oh
Big
my
Mama's
gosh,
gone.
That's so awesome.
I was able to.
Okay, so that was an actual removal. So that makes a lot of sense when you see that visually, doesn't it? Those are the two different, that's the differences. Okay, so do you have your CPTs handy?
Yes, ma'am.
The first one that we saw was the incision and drainage of a cyst. It doesn't give us really any more than that, but I want you to look at page 91 of your CPT manual. And we're looking at the incision and drainage part. So, do we remember what kind of cyst it was? Should we go back and see if she says? Let's go back and see if she says. I was too busy waiting for the cottage cheese to come out. Let's see.
It was manageable, but in the past year
On this area on the body.
It's really unusual to see something of that size in that area. So it gets me to wonder, is this a lipoma? Is this a cyst? Is this something else? Love a good mystery, and Ronan certainly has a mystery here.
Or solid. So initially I'm just going to numb up one area and just see if we can't pull out any fluid. And if it doesn't happen, then we know it's something more solid, and then we can go ahead and make a longer excision. I hope that doesn't scare you. Any of this scares you, does it? We're gonna get rid of this. Don't you worry about it. I'm just gonna see if I can pull any fluid out of here, all right?
No problem.
Come on, something's coming out, but not a lot. See that right there?
Yeah.
I think that might be a cyst. It looks like cyst fragments. If it
So what did she say it was?
A cyst.
Just a cyst, right? She didn't get into more detail. So let's see if we can decide which CPT code we would actually use for that cyst.
$10080.
She didn't call it a pylondial cyst. She just called it a cyst. So
Would it
that's,
be 10060?
what do you guys think? 10060?
10060.
Okay.
Okay.
Why wouldn't it be 10061?
It wasn't multiple?
And it
Was
wasn't
it multiple?
complicated.
And it
It was
wasn't really
simple.
it wasn't really complicated, was it? It was huge, but that was a fairly simple, gonna cut it open and let it drain, right? So it was really a simple procedure, although it was gross and big, right? So he may have felt like it was a little more complicated. Okay, so our second one is what? A removal of a cyst. And I'm not real sure because we don't know the margins. I'm not real sure we're going to be able to really get a code for that because it didn't give us a lot of information, right? But we know that we're going to be looking at the excision of, and then we have, if you look on page 101, there's a whole section on pylondial cysts.
Huh.
So did you guys remember? I don't think she really ever said exactly what kind of cyst that was. So, but I just kind of wanted to get you thinking in that area. So, it's really fun to pull up the Dr. Pimple Popper or pull up. YouTube is a wonderful, wonderful resource. I mean, you can find anything you want on there, but I think one of the funnest things to do, and we're not going to do this now, but we will watch House at some point in small increments. And we will begin to listen. I'll be asking lots of questions. Okay, how was he unethical will be one of them. Because he can be a hot mess sometimes. But when you really start training your mind to listen for procedures and diagnoses, it really does help you absorb the information and you'll be able to read your medical records better. And also, when you go to the doctor and you're doing different things, you're going to start understanding. Miss Kelly, you want to tell them about your experience at the doctor the other day?
So I started out with a mass underneath my left arm, and it's cellulitis. It is 4.7 centimeters tall, 9.9 centimeters wide, and it goes in as deep as a tennis ball. And he couldn't do anything with it because it was too hard of a mass. So he's just put me on antibiotics. It is now draining, thank goodness. Hurts like Hades, but it's draining. But he had me look up or tell him the different CPT code for me being a new patient in his office. He had me look in his ICD-10 book to look up what he was doing because I told him I was taking this class.
Oh,
To help him out with because he was having a hard time finding it himself, so we did it together.
So isn't that a good thing? I mean, it's like, oh, yay! And it's going to be exciting. I go to see Dr. Shaw. He's an optometrist, and every time I go in, he'll say, "Hey, I'm having trouble finding this code or that code or this code," and I'm like, "You need to put me on the payroll." He just laughs. But, whenever you're out there and you're at the doctor or you're in a medical facility, you need to be marketing yourself. You never know who you're going to know that will know someone that needs a biller or an insurance specialist or somebody in that nature. So I want you guys to begin to, pay attention to those things. When you're at the doctor, watch how they're treating the patient. See, are they leaving their names and numbers where people can see it? That's a HIPAA violation. Or, you'll start picking up those little things as you go through the course, and in your head, you'll be going, they're not doing that right. Now, when you get into your facility, you can't tell the doctor, my teacher taught me that you're doing this all wrong. Everybody has their own way. You will not stay long if you do that. But you're just going to start looking at things differently. So who has enjoyed the integumentary system so far?
Me.
It's so cool. And it's just crazy that we just don't seem to have enough time in it. I would like to spend a whole 2 weeks just, I used to have a game that we would play in class where you actually, it was Mr. Pimple. And then it had these flesh things, and I would fill them with the Vaseline, and the students would actually excise the.
That's weird.
We loved it. It was so fun. But we're doing the best we can with what we got. Dr. Pimple Popper's great. Do we have any questions? Nope. All right. Well, I'm so glad I got to see you guys. I'm going to hang on a minute. I'm going to stop.